Hello everybody, my name is Amadej Lah, I'm your favorite plastic surgeon and you're watching Boobs by Plastic Surgery show on YouTube. Don't forget to, of course, subscribe to my Instagram profile, to subscribe to this channel so you're informed when new shows are on. So, what is tummy tuck? Tummy tuck is a plastic surgery procedure where we remove the excess skin in the tummy, in the abdominal area. Apart from excess skin, there can be other problems as well, like dysfunctional muscles, then stretch marks, then hernia, umbilical hernia, and of course scars, usually after cesarean delivery. So let me just show you or draw you a little bit what is going on in this, in the torso, in the stomach area in these patients. So this is a torso of a woman or a man, but usually they're women. So after pregnancy, what happens? The skin becomes loose. So there is some skin hanging like this. Okay. Then there could be stretch marks. Something like this. This is the belly button. And then the problem, a very important problem, of course, are the muscles. The muscles of the six-pack muscles, the recti muscles, the vertical muscles of the abdomen, they do not stay together like they should be, but they spread, they go up, they move sideways. So this is what happens. So these are the two six-pack or recti muscles that are dysfunctional. Why they are dysfunctional? Because when they stretch, they do not move in this way, but they move sideways. So what happens in these situations when they're very bad? Actually, the stomachs, when you're pulling the stomach in, it comes out, because when you stretch these two muscles in this dysfunctional way, so when you stretch them, they move like this, and of course the content of the stomach, it's usually more or less intestines, comes out. It can be sometimes this diastasis is very narrow, like maybe 2 or 3 centimeters. Sometimes it's much worse, like 4 or 5, even more centimeters. And in very bad cases, we even need to use mesh to close this gap. So why does this happen? Usually there are 3 main reasons. One is pregnancy, which is the most common reason. So the pressure inside the stomach building up during the pregnancy, during the 9 months, of course stretches these muscles and they slip apart. So they are not touching each other anymore. The second common problem or reason is the weight loss. Sometimes, of course, when we gain weight, we also gain weight inside the stomach, and then, of course, it makes the same problem. It tears the muscles apart. The third problem, or the third reason, is genetic. So, one problem is the excess of skin. One is the second are the stretch marks in this. And usually in the lower part of the stomach. The third problem are the stretched muscles. Then, because the muscles move sideways, there can be hernias. So usually it's an umbilical hernia inside the navel, inside the belly button. It looks like a little ball or a little something like inside the belly button, and it can turn on the outside. And of course, the one more problem of the stomach, especially after pregnancy, are the scars. Usually the scar of the cesarean delivery. This scar at the beginning might look fine, but after a few years, it can attach itself to the muscles in the depth, and then during aging, this skin that is above the scar falls over the scar, and it makes a deformation like this. So this is the stomach, and then it's like this. So here is the scar inside this area. So and it's actually getting worse and worse with years. And of course, abdominoplasty is one of the ways to correct this, or it's actually the only really effective way. So what are the types of tummy tuck? It's not just one single procedure. There are actually 4 different types of surgery. Most common is the classic abdominoplasty. The classic abdominoplasty is the procedure where we remove the excess skin in the lower stomach. So we remove everything between pubis and the belly button, and then we pull the skin down. I will show you some photos afterwards so you get an idea what that means. So by this procedure, we remove all the excess skin. Sometimes, of course, we remove more, sometimes a little bit less. It depends, of course, on the case, on the situation. Then what we can do, we can fix the muscles, of course. We can fix the hernias, and that's about it. I mean, we can do most of the things using this procedure. So the classic abdominoplasty. What we cannot remove are the stretch marks that are above the belly button. So if there are stretch marks above the belly button, they will not be removed. They will stay there. But after surgery, when the skin is stretched really hard, if also the stretch marks get stretched, and they are much less visible than before. So usually it's also a good solution for the stretch marks above the stomach, above the belly button. So this is the first one, the classic. The second type of abdominoplasty is the mini abdominoplasty. Mini abdominoplasty is the procedure where we don't make a very big incision like this one. We make a much smaller incision. So if I just draw quickly. Usually we use it to remove the scar after the cesarean section. So this is the old scar, and usually there's of course a little bit of excess skin in this area. So we just remove this lower part of the skin. We do not touch the belly button, and we pull this skin downwards like this. So what we get here is we remove the scar. We can address the diastasis, but not as effectively as with the classic abdominoplasty. And of course, we stretch a little bit the excess skin that remained after pregnancy. This is a good solution for in cases where there is really minimal excess of skin. Where there is more skin, a classic abdominoplasty should be performed. So then the third type of abdominoplasty is the circumferential abdominoplasty. It's actually a procedure where we remove the skin not just in the stomach area. We go like this with the incisions, but also in the back. So we also remove some of the skin in the back. We go all around the body. It's a procedure that we do after weight loss. It's not a procedure that's very common. It's much bigger procedure, but after like big weight loss of, let's say, 50 kilos or even more, of course, there's not just excess of skin in the stomach area, but also in the back area, where we remove all the skin, this excess of skin all around, and make it tighter. Then the fourth type of abdominoplasty is the inverse abdominoplasty, or the reverse. So it's not performed by an incision in the stomach area, but it's performed through an incision under the breast, so like here. So we remove a little bit of skin here in the upper part, and we pull the skin up. Inverse abdominoplasty is used in those rare cases where we do where there is excess of skin in the upper stomach area here, and we simultaneously do also breast surgery. Not that common combination, but very effective when it needs to be done. So what happens when we do the tummy tuck or the abdominoplasty? Of course, we remove the excess skin in the stomach area, but one other thing, very important thing happens. When we pull the muscles together, we also get this. So actually, we get a slimmer waistline. We quite commonly combine the procedure with some liposuction to remove even more. And of course, we do the liposuction also on the back, and we might use that fat to fix the gluteal area, the buttocks area. So it's a very versatile surgery. We can do many different things together. So let me just explain a little bit about the operation. So the procedure, of course, first what we do is we talk to the patient again, and we discuss everything what we are planning to do, because of course, like I showed you, there are many different things that we might do. Then we decide on the incision, so where the cuts will be. Then if there is any extra liposuction that we would need to do. Then we discuss about the muscles, what we need to do to correct the muscles, and if there's any hernia repair necessary. So if there's like a hernia in the umbilicus, in the navel, in the belly button, we might fix that as well. So that is before surgery. The surgery is performed in general anesthesia, so the person is sleeping during the procedure. It takes let's say between 1 hour or even less, 45 minutes, and 6 hours, because if we do only mini abdominoplasty in a skinny person, it's a quick procedure, not that complicated, and it's short. But if we combine it with liposuctions, with hernia repairs, and with, let's say, breast augmentation, the time of procedure can be up to 6 hours. It can be a very long procedure, but with very dramatic results sometimes. The recovery after the procedure is it's a little bit longer than the other procedures that we do. Again, it's very individual. It depends a lot on the person. It depends on a lot on the procedure that we do, of course, the procedures that we combine. It can be from like almost a few days when we do just the mini tummy tuck, mini abdominoplasty, up to, let's say, 1 month when we do everything together. Usually we use drains. So drains are these tubes that suck out the fluid that would accumulate inside the wound. We remove the drains after 3 to 5 days. Pain is quite well controlled. We use a lot of painkillers, and of course, as with most of our procedures, we combine the procedure with the local anesthetic that has a long duration. So during the procedure, we inject the wound with local anesthetic that controls pain for up to 2 days. The body position after surgery is quite important, because you have to understand, we stretch the skin, we stretch the muscles, so the bent position is much more comfortable for the patient. Up to 1 month, the patients after tummy tuck are walking around with their torso bent. But that, of course, alleviates pain. It helps the skin, so it's not that strong tension. And it's the recovery is that way much more effective. To start working depends, of course, again on the type of procedure. But let's say after an average abdominoplasty, you can start to work after 2 to 3 weeks. Exercise after 1 month. If there is also the muscle repair, so if there's diastasis involved, I suggest not to do any abdominal exercises up to 3 months. So it heals really well. The final result is visible after, let's say, 1 year, when the scars heal. when they become skin color, when they're not red anymore. Sometimes the scars, of course, heal faster. Sometimes it takes a little bit longer, but let's say 1 year is the time when the scar settles. Also, the swelling of this the area around the scar sometimes needs a lot of time before it goes away completely. So let me show you some photos of the procedure, and then I will answer some very common questions about tummy tuck. So this is a typical patient for tummy tuck, and as you can see, there are all these things that I was talking about. So there is the excess of skin. Then what else? And you can see the torso is quite flat, so it's like it's not really hourglass shaped, but it's really straight. And so there are of course stretch marks, and you can see skin, as you can see here, and of course the excess of skin. Then and sideways this might look like this. So this is a young lady after a baby, and of course for a young person this is quite an unacceptable situation. It's very difficult to put on bikini because, you know, the excess of skin is making all these problems. On her you might also notice the back. You can see that also there's some excess of fat, and the buttocks is quite flat. So in cases like this I would do liposuction in the upper area to fill, of course, the buttocks, to make it rounder and of course more attractive. This is a skinny person, a very skinny person that most of people would say she does not need a procedure like this, but as you can see, she has a lot of stretch marks, and the belly button is almost gone because of the excess of skin. There is also, of course, the hernia inside the belly button. So she would, of course, she was a very good candidate to do abdominoplasty, because it's quite an easy procedure on a skinny girl like this, but we can fix all of these problems that I was talking about before. This is a case of a scar, as I was explaining to you before. As you can see here, there's a scar in the lower abdomen, and the skin with some fat is hanging over this area. So this is a candidate to do some, of course, in some liposuction in the upper area, and in the lower a mini tummy tuck to remove this excess skin and to really pull well the skin. If we go on, this is again a situation that many people would say that is not a candidate to do abdominoplasty, but you know, she's also after babies, and to fix this bulging stomach, this is the only way. She's one of those cases, you know, that you probably know, or maybe even you are like that in the morning the stomach is quite flat, quite nice, but then during the day it comes out, and it becomes really annoying. Also, like I said, here the most important is not the problem of skin. Here there's a problem, of course, the muscles. So there's more important to fix the muscles than to remove the skin. And of course, these are the extreme cases after extreme weight loss. This gentleman lost over 100 kilos, and of course we had to remove all this skin and everything, and fix the muscles and do everything. These are some cases before and after. This is a young lady after babies. Of course, we fixed also her breast, but you can see the stomach area, a lot of stretch marks. The belly button is almost invisible. Look at the situation here. There's no form actually. And then this is after surgery, a few months after, and of course much better situation. This is a case of as I was explaining before, the inverse abdominoplasty, where there is this problem of the upper abdomen. You can see all this the stretch marks and excess of skin in the area above the belly button, and of course you also had quite ptotic breast. And what we did was, of course, to do the breast lift and remove and of course do the inverse abdominoplasty to make the upper area flatter. or yeah, smoother. I mean, it might not look perfect, but for a person like this is a perfect result. Extremely happy. And this is a scar that would remain after a classic abdominoplasty. So the scar is low on the stomach area. She pulled down her panties here, but if she has the panties in her normal position, they cover the scar completely. And of course, the scar in the stomach is in the belly button is practically invisible. So let me answer some of the most common questions about tummy tuck. A lot of girls say, okay, I will just do more exercise and this situation will go away. Or why don't you just do liposuction and to remove the excess of fat and it will be okay? Well, it's not really that simple. You know, if there's excess of skin, there is no exercise, no cream, no massage, nothing that would fix that. And if there is there's the muscle problem, again, no exercise will bring those two together. Maybe a little bit in the early post pregnancy time, but later on not possible. So to address those things, the only way is a tummy tuck. Okay, so the one question, a common question, is also the duration of result. Well, this is a result that you do once in your lifetime. If you're finished with having kids, if your weight is stable, you do it once and it's forever. You don't have to redo it after 10 years or 20 years. No, not at all. And the question is, can you do other procedures with that? Of course, we like to do that combinations a lot. The most common combination actually has a name. It's called tummy tuck. Not tummy tuck, mommy makeover. A mommy makeover includes a tummy tuck with some sort of breast correction. Usually it's breast lift and implants. Sometimes it's just implants, sometimes it's breast reduction. It depends, of course, on the situation of the breast. And I really like to do some liposuction with that and put that into the buttocks area in the way of like a BBL, so Brazilian butt lift. So what we get during this type of procedure, mommy makeover, we get a nice breast, a youthful breast, lifted, filled like before, of course, pregnancies. Then we get a nice flat stomach, and of course also looking from behind, the nice shaped torso with a round buttocks area. So that was the tummy tuck. If you have any questions, please let me know. Write me in anywhere, Instagram, Facebook, or YouTube, and I will try to answer. Thank you for watching, and until next time, bye bye.